Good afternoon. I would love to introduce Sharonya and Vivienne. Their project is the effective exercise on regulatory T cell populations in rat mammary. That A word came up again. Sharing samples using FOXP3 and CD25.
In rat mammary adenocarcinoma, 226 using FOXP3 and CD25. My name is Vivienne, and I'm Vivienne. This year, an expected 1.7 million people died of this cancer, resulting in 600,000 deaths in the United States alone. These numbers are only expected to increase as the global estimate for the year 2030 is 21.7 million new cases of cancer, resulting in 13 million deaths worldwide. Cancer is the uncontrollable growth of abnormal cells in the body resulting from critical mutations in the DNA. Now, we all have some mutations in our DNA due to discoveries in the transcription process. However, it usually takes 4 to 5 mutations in the DNA to make a cell cancer. Cancer becomes malignant when the primary tumor metastasizes or spreads to sites of tissue that are local to or even distant from the primary tumor to continue growing more cancerous cells. These cancer cells thrive by ignoring apoptosis and working with the individual's own body to foster the growth of the tumor by inducing nearby cells to form blood vessels. That way the tumor has access to oxygen and nutrients. Cancer cells are also really good at interacting with specific lymphocytes to manipulate the immune system into defending and promoting the progression of cancer. The immune system protects the body from foreign organisms and normal cells. It consists of lymphocytes such as B cells, T cells, and macrophages. Macrophages engulf blood vessels and take them to the T cells. T cells mediate the immune system and tell what to do with antibodies, the antigen. And these cells, when instructed, make antibodies that go and create antibodies at mark cell determination. Lymphocytes are created in bone marrow environments, and they travel around the lymphatic system to include lymph nodes and blood vessels organs such as stem cells. And all of the cells monitor protein markers for health. So we are currently focusing on T cells and then 3 main subpopulations of T cells, which is cytotoxic. And this gift is a cytotoxic T cell killing in abnormal or foreign sessions. There's also helper T cells that help the immune system, and regulatory T cells, which is what we are focusing on, and they regulate the immune system. Now, in cancer patients, there's obviously a continuous interaction between the lymphocytes and the tumor. The lymphocytes target and attempt to eliminate these cancer cells. However, due to a specific subpopulation of T cells, or regulatory T cells, this job is infinitely harder. Regulatory T cells in a healthy individual are meant to suppress lymphocytes. In other words, lymphocytes are lymphocytes that mistakenly identify healthy cells as abnormal, foreign, and detrimental to the individual, and therefore try to target and eliminate the cells. This results in intense damage. So regulatory T cells step in to suppress this immune response and prevent autoimmune disease. However, in an individual with cancer, these regulatory T cells actually serve a pro-tumorigenic function, meaning their presence in the tumor microenvironment actually interferes with the other lymphocytes' ability to attack the cancer, and thereby enabling the tumor to proliferate. FOXP3 is a transcription factor essential to the suppressor function of regulatory T cells. FOXP3 actually implies the molecular features that are responsible for cell function and cell maintenance in precursor T cells. And because of this, they're going to be most reliable marker for identifying regulatory T cells. Now, earlier I also mentioned CD25 in conjunction with FOXP3, and this is why. We decided to focus on a cellular pathway that upregulates FOXP3 involved because of CD25. So as you can see, this IL-2 signaling molecule binds to IL-2RA receptor, also known as the CD2 membrane protein. This binding activates the JAK protein, which in turn stimulates that protein, which is then responsible for upregulating FOXP3. Now, the upregulation of FOXP3 is what results in an increase in regulatory T cells, which, as we have just mentioned, suppress your anti-tumor immune response. Regulatory T cells expressing FOXP3 are highly immune suppressive, as they suppress the activation and expansion of tumor-specific effector T cells. And they also monitor the physiological response in the tumor. For example, tumor angiogenesis. Earlier, I referred to how cancer cells can actually induce the environment around them into creating more blood vessels. That's what the tumor angiogenesis refers to. This way, the tumor actually gets excess access to oxygen and nutrients and is able to grow and expand much more rapidly than the average healthy cell would. And what's really interesting is with all these things considered, tumor-associated antigens may actually drive the rapid expansion of regulatory T cells. Because it has been shown that in patients with cancer, when the primary tumor is still emerging and developing, regulatory T cells, for some reason, are initiated into the cell cycle much faster than conventional T cells. And this will increase the potential of proliferating regulatory T cells in the lymphoid tissue, tumor, and blood of cancer patients. And as we have probably figured out by now, this elevated number of regulatory T cells in tumors is not directly causing cancer patients. As you can see here, the x-axis is one marker diagnosis and the y-axis is proportion to mapping. So, and the lines correspond to the concentration of regulatory T cells present in that cancer patient. The red line signifies a high concentration of regulatory T cells. And obviously, there's a drastic, almost immediate drop-off of the population of these, unfortunately, significant amounts of those cancer patients die very quickly after diagnosis. With very few not making this terminal diagnosis. Whereas with a low concentration of regulatory T cells, their population was sustained for a longer period of time, and the drop-off was more gradual, even though it was unfortunately the ultimate. A low concentration of regulatory T cells, some cancer patients waited to even 80 months after diagnosis, and some quick mental math, that's 5 years right there, which is the red green line. So because of the concentration of this subtype of T cells, cancer patients were able to live for 5 years longer after diagnosis. So, following that up, a high population of regulatory T cells corresponds with poor prognosis in cancer patients. So the removal of regulatory T cells should enhance their anti-tumor immune response, and it does. And several studies conducted recently will show that the depletion of regulatory T cells actually is considered an effective cancer immunotherapy treatment strategy for cancer patients.
So the U.S. Cancer Rehabilitation is cancer patients that have various types of cancer and are at various stages of diagnosis, and they run them through our exercise regimen. And the reason why we do this is because exercise actually improves the quality of life and gets rid of the side effects that are commonly associated with cancer treatment, which is chemotherapy. And exercise has also been shown to reduce the risk of tumor development, recurrence, and death. And also, we're doing situations of gravity in some patients to relieve. And exercise also increases the action rate. And so, physical exercise decreases the rate as well as in the study of mice, there's 50% reduction when tumor is involved that ran a wheel. And there's also in a human meta-analysis, there's a positive correlation between the amount of exercise and the risk level, and 80% of them.
So, quick sum up. We know exercise positively impacts cancer somehow. However, the specific biological mechanisms through which exercise achieves this are relatively unknown and still being studied. It infers that exercise indirectly impacts cancer by directly affecting certain lymphocytes. So we decided to look into regulatory T cells, which, to recap, suppress the anti-tumor immune response in cancer patients. therefore allowing the tumor to proliferate and grow. So this research is going to be effective exercise on regulatory T cell count in sedentary versus exercise rats. And it is our hypothesis that the exercise rats will have a lower regulatory T cell count in both their tumor and spleen. So to do this, we first split up the rats into two groups, the sedentary cohort or the exercise cohort. And once this was assigned, we injected the rats. Flank injections were administered MCL-M3, which is an genetic cancer line to the rat, meaning their bodies would not reject the cells as foreign because they came from constant cells. And the tumor growth was monitored after injection, and exercise was reported using cell counters, meaning the machine detected how many rotations the rats ran over a specific period of time. 21 days post-injection, or when the tumors reached 3 centimeters in diameter, the rats were euthanized using sediment into barbitol.
So the specific tumors were cut into small sections and placed into cryoballs that were filled with OCT or optimal and temperature. They were later frozen using liquid nitrogen and isoprene. They were cryosection at 4 microns and placed onto a slide that was coated in polylysine. And the reason why they were coated in polylysine is so the samples did not move. Also, on each slide already, some 2 of them had tumor samples and 2 other samples on the slide were inflamed, and then there was 1 other negative control. And later they were fixed in acetone to prevent cell dissociation, and then washed with TBS to dissociate the cell membrane. So we were then in a permeable, we can try 100 and 20, and blocking under NGS and natural growth there was applied to increase inside. So this autologous control sample was stained with CD25 and COX-3 antibodies, and later all the samples of both autologous and negative control were stained with the host dye that were in lab membrane. And so during one of our trials, we attempted to use an antigen retrieval method called Sujan block speed. And what it was supposed to do is block all the background fluorescence so we could only see the T cells. However, when we used it, it blocked out all the fluorescence so we couldn't tell if there were any T cells at all. So I think the future is to experiment further with it, look at the concentrations, and then also use the pilot sample protocol.
These samples on the slide were then visually using the fluorescence microscopy. For each sample, 2 fields of view were then selected and observed, and the images are translated into quantitative data by physically counting out the number of T cells present. So this is our negative control, and down here is where our weight side was applied, and that shows the same for the cell nucleus. And up here, the top left, that's where the 25 fluorescence should be. And over here is the 0. And the reason why there are no fluorescence is because it's the negative control, so we do not apply the antibodies to it. And on the bottom right, that's where we overlaid all 3 of the previous pictures, and that's where you see that the T-reg cells. The reason why we performed legal kinetic controls is to make sure that the antibodies that we applied what was causing the T-reg to fluoresce so during the budget applied. And this right here is a polymer control tissue sample. And the other important mention is red fluorescence indicating the presence of CD25, which is a trans-membrane protein. So how the fluorescence microscope works is with a filter, it will emit a certain wavelength of light. And certain fluorophores attached to the antibodies that we apply to the tissue sample would fluoresce under certain wavelength conditions. So, for example, for the CD25 right here, we use the PE filter on the fluorescence microscope. So the fluorescence microscope emitted that certain wavelength of light, and the fluorophores that were attached to the CD25 antibodies fluoresce consequently showing up in red fluorescence. The same thing happens with FOXP3, the transcription factor, except it's fluorescence. And as my partner mentioned, the lower left is from the Gapi filter, which was for the dedicated nucleic cells. The bottom right is an overlay of all of these three images, and we specifically boxed CD25 positive oxygen positive cells. And what this means is they go out with red, green, and blue light, meaning that we can be relatively confident that these were regulatory T cells because, as we mentioned earlier, regulatory T cells are characterized essentially by FOXP3, but also the same CD25 transmembrane protein.
So this is comparing the average regulatory T cell count and the range of cemetery extract cuts, and in cemetery there is an average of 15.33 cells, and exercise there is an average of 11. For two examples, there was a larger difference, with cemetery having an average of 16 cells, and exercise having 2.66 cells. And the overall tissue count, when we combine the tumor and the spleen for both, you can see that there is a great difference between 31.33 cells for cancer and 13.67. And so basically, while none of our data has statistical significance, however, there is a trend of exercise animals having decreased T-reg counts. And so with the p-value or the alpha value of 0.05, we fail to reject our null hypothesis. And our null hypothesis is that these T-reg values will be the same in a terminal split.
We'd also like to note that we did talk to our resident data analysis teacher, and it was noted that independent t-tests were used to analyze the results, but that is not the most efficient or most accurate way to assess the significance of the data. The most accurate way would be multivariate test. However, we are not familiar with that, so we wanted to stick with analysis that we can understand and interpret.
And the limitations we came across was this is a rather small sample size, as we only use 3 rats per cohort, which is probably a reason as to why there was no statistical significance. There was also, this is the first special FOXP3 IAC protocol, and it can be expanded on further in the solution. And there was a lot of CD4 antibody, which differentiates T-reg cells from T-reg cells, so we are not 100% sure that it's but we are very confident. And also we used NGL3 instead of NAPI3 for the cancer cell line. And NAPI3 is a less aggressive form of cancer, so we can have more data points, and also it is more comparable to the progression of cancer in the skin.
Also, a point of interest was the identification of CD25 positive cells. This was unexpected, as when we set out to conduct this research, we were anticipating to identify regulatory T cells to be positive for both in terms of phenotype. So the fact that we did recognize and identify cells that fluoresce with green but not red is a point of interest to further explore. And we could use CD4 antibodies, CD8 antibodies to perhaps explore and maybe definitively research what type of cells there are present here, as they could be cytotoxic T cells or helper T cells, but we do not know as of now.
And to continue on the future directions, we recommend using the complex microscope, as it is a more used and I guess the correct version of words to the cells, and also using flow cytometry would allow the researchers to collect greater amounts of data. And increasing the sample size would also help with the variances, as well as creating a protocol for Vivienne box.
We would like to thank Sharonya and Dr. James Wing for mentoring and guiding our protocol, as well as extend our sincere invitations to Shane Murphy for all his guidance and support of the project and Ms. Vivienne for the data analysis.
We would also like to thank the community for keeping right up to the project. Also, Dr. Fuller for the hands-on.
I would like to personally thank Bioresearch Health Sciences for sponsoring my moment here at FSI, and Equine for sponsoring my research here.
And I would like to thank the Community Foundation for sponsoring my research here.
Thank you so much, especially to all FSI staff who made all of this possible. We really could have done anything without you. Thank you so much. Any questions?
Okay, so you said that the average T cell
Well, that's the tissue.
But do you know if the average
No, we don't have a type of reference point. Which would be also a way to further some research comparing that once we implement it into, or make it more applicable to the human body and how cancer progresses there. But we do not know whether the reference point for that. Jay?
How big was the tissue sample that you had?
Like, very well, for microscopic, but do you mean like?
Like, just like a sport.
Yeah, for microscopic, and I mean, if you want to go for like, I would put it on the slide. Do you guys, crowd animals are about this big. So samples themselves are small in terms of two-dimensional area, but are actually extremely small in terms of thickness at 4 microns, which, like I said, has told me before, is about 2 centimeters. Any other questions? Yeah.
Why do you pick the stem cells originally? Because it's part of it's kind of lymphoid tissue, which is where the T cells go throughout. So we figured it's positive control, so no matter what, there's going to be T cells there. And then we found that there is also extra connected to the non-active so we decided to keep it moving.
Nice.
So if you started to continue the project, then where would you go?
I think you mentioned the future directions. I think one of your primary interests was the So we could use different antibodies to kind of try to pinpoint the identity of these specific lymphocytes because we are, as I'm not sure, we don't get the regulatory T cells. So it would be interesting to kind of try out different antibodies, see what fluoresces, and try to pinpoint the specific lymphocytes we are. Specifically, I guess what we did, one thing that Lauren mentioned was Vivienne black for to kind of I guess improve protocol, and because it was the first successful IHC approximately positive protocol, there can be further adjustments and improvements on the road. As well as primarily speaking increasing sample size because we did only 3 rounds in cohort, which was a huge factor that played into the lack of potential. Questions? Bye.
So what are some implications of the results that we want about
So we did make that between, we'll affect the cancer, exercise the cancer, but we don't know how specifically on the biological level exercise affects cancer patients positively. So if we can better understand how exercise interacts with specific lymphocytes, that would be very beneficial in terms of altering the way we treat cancer patients, and also exercise would be more validated as a supplemental way to treat cancer patients. Great.
Could you tell me the difference between the blood and the
I'm sorry, could you repeat the question?
Is there a difference between blood and
I do know there are specific types of, even there are further divisions of regulatory T cells. However, we just study them just regulatory T cell categorization because we also combine these 2 different antibodies. So when you only use 2 antibodies, that is not really enough to distinguish between certain cells, especially when in that that narrow margin of specific sub-regulatory T cells. So we weren't able to distinguish that, but we can say with confidence that we did try to identify regulatory T cells with these antibodies.
Are there current drugs and molecular treatments that aim to
Yes, of course. So the question asked was, are there treatments in place to kind of aim at reducing the self-count in cancer patients? Yes, there was this article read by authors in Sakaguchi, sorry, I apologize for that. But basically what she's saying is they have been doing, they've extensively researched it, they are currently in the process of extensively researching treatment to deplete regulatory T cell count, and it has been noted that, especially with specific cancer types, depletion of regulatory T cells is a very effective cancer immunotherapy treatment strategy. Brian?
Why did you guys have such a small sample size for your gender and emphasize rat group? Why were you not able to?
Okay. So we were not, as of the PACE project and tax research and all, we were not the ones that physically were there from start to finish of this project and involved in the breeding and immunization, the dissection of the rats. And we became the UNC had switched cancer lines. So right now they have some samples from the MT-103 cancer line and some from MAT3. However, we did not have enough tissue samples saved on actually either cancer line to look at the tissue samples of more than 3 rats. And that is another limitation that we have in our project, lack of tissue samples from rats. We good?